Hi there, welcome back to my YouTube channel. Please remember to like the videos here on YouTube, click on the notifications so you get notified when the next video is being released, and also check out the playlist for more videos to do with cosmetic surgery. Also check out our brand new website called allthingscosmeticsurgery.com. So today I'm going to be speaking to a lady who organises cosmetic surgery procedures in Turkey. Hi there, thank you so much for joining me today. Just tell me first of all a little bit about yourself and the company that you work for.
Sure, Anna. Thank you so much for having me today. I'm Ece. I am the co-founder of Klinik Europe, and Klinik Europe is a company providing convenient, worry-free plastic surgery packages in Antalya, Turkey. And and also Klinik Europe offers the best and the safest results for its patients, along with the smoothest journey.
Okay, so just for someone who doesn't know anything about medical tourism, what countries can the clients be from that you're able to help?
So majority of our patients are from England, Ireland, Scotland, the Netherlands, United States, Canada, and Australia, I would say.
Okay, brilliant. Okay, so quite far then. So people will actually travel, quite far to have procedures. Brilliant. Okay, so just tell me, why would somebody travel, for surgery in the first place? Why wouldn't they just have surgery at home, kind of thing?
Yeah, you're right. I mean, I think there are many factors contributing to the quality of plastic surgery service, like either it's abroad or in their hometowns. So it's just finding the hospital, deciding on the accommodation, pre-surgery consultations, quality of the surgeons, medical personnel, aftercare, follow-ups, and there are just so many questions. So I think that why they would travel to Turkey for plastic surgery is that Turkish surgeons are very experienced. So and they have patients all around the world, and they have the chance to practice with different body types, with different medical conditions, different ages, and they just have their patients in Turkey for a limited time. Which means that they don't have any time for any mistakes. So they just have to be working meticulously for the best results, and they are used to it. And also another thing is that they follow the trends very closely. So for example, about rhinoplasty or tummy tucks or breast augmentations, they know what the patient would like, if not as well as what it would suit the best for them. So I think that's the reason why people are preferring Turkey for their plastic surgery procedures.
And just tell me, the surgeons that you work with, are you just working with one surgery and one hospital, or do you have many that you're working with?
So you remember I told you about all of the questions, a patient confronts before having decided on the surgery. So we do all the research. What I meant at the beginning by very free plastic surgery packages is that we look for the best hospitals, we look for the best surgeons, we have their revision rates, their certificates, their previous works, we interview their patients, and then we decide on the surgeons as well as the hospital. So we have a couple of hospitals we are working with. They are in the same organization. And also the surgeons are a minimum of 15 years experience with their cases. So we have a couple of doctors and hospitals, I would say.
Brilliant. And just say if I was coming from the UK, I know that you're doing the research for the clients, but would I be expecting them to have the same kind of qualifications as from the country that I'm coming from? Or, what's their board certification like compared to other places?
Yeah. Turkey has the General Medical Council, like GMC. It's as it is in UK. So they hold the central registers of the doctor's qualification. It's the same as the UK. And also this medical register shows who is properly qualified to practice medicine. And also the special register shows that they are qualified to perform surgeries. So they are pretty much similar in that sense. And it's very easy to check through online and with surgeon pages.
Brilliant. Okay, so that's good. So just tell me, what kinds of surgeries would you be offering to patients? Is it all kinds of cosmetic surgery procedures, or is there like one that's more popular than the other that people go for?
Yeah, so I would say we can divide the procedures as face and body procedures. For face, we have like almond eyes, foxy eyes on high demand, face lifts, temporal lifts, brow lifts, forehead reduction, facial fat transfers, lip lifts, and of course, rhinoplasty. And for the bodies, I could say all sorts of breast augmentation with implants and fat transfers, breast uplifts, reductions, implant replacements, tummy tucks, mommy makeovers, liposuctions, body lifts, body contouring, arm lift, thigh lift, bum lift, and pretty much everything you would think when you think of the body and the face.
Brilliant. Okay, so you said there's like some clients for travel from as far as like the US or Australia. Have you ever had a situation where a client has come over to Turkey and then the surgeon has told them that they're not able to do the surgery on them? Like, what would happen in that kind of situation? Is there anything that you do to make sure that doesn't happen? Because, they haven't had tests and things like that beforehand.
Yes, actually, we ask all of our patients to present some blood tests and liver function tests beforehand. Like from the beginning of their contact with Klinik Europe, we have their complete medical history. So form filled, their pictures, what they would like to achieve, what is their goal. So after we say that they are good for the surgery, our team of surgeons, anesthesia, and head of aftercare run their cases. I mean, they studied the cases. So they say it's good. They are good either they have medical conditions, chronic conditions, or they're just normally healthy. So we know their cases before they confirm the surgery. And we say that it's okay, we can book your spot. And then 4 weeks or 5 weeks before the surgery, we ask them to present some full blood tests and liver function tests. They send us these tests. For example, we may need to put their blood levels could be low. We may need to put them on iron supplements, or we may need to put them on greens diet for cholesterol and blood pressure and sugar. So we manage the case. This is what sets us apart from the competition, basically. So the cancellation rate is that not with what's booked in the original surgery, but they want some extra procedures, for example, like liposuction on top of multiple surgeries. That's we cannot do. If we cannot do, that's the only thing we say no or cancel, basically. And this works great.
That's good. That's good. So just tell me as well, would there be any like issues with like language barriers or anything like that, seeing as some people wouldn't be speaking the same language in Turkey?
Yeah. So we have our hosts and our nurses who are fluent in English as well as German. Some of them are fluent in German. And also we have a lot of patients from Norway as well. So we have people in our team speaking Norwegian. So just to make sure that because we are, our patients are not just some names on the book. We know what they need, what they may require. So we can always hire a translator for them who also knows their case. We can allocate this translator to their cases. So the language, I wouldn't say that it's an issue with us.
Great. And just last question for you. Could you just tell me a little bit about kind of what the experience would be like, say, from the moment that I would arrive in the country? Are you picking up from the airport and arranging accommodation and things like that? And also, how long would somebody be staying after the surgery, and what would the aftercare be like when they return home?
Yeah. So just one day before, for example, after you book, you send us your flight tickets, and then we can track your flight. One day before your flight, we say that, okay, my name is Mel, and I will be greeting you at the airport. This is my number. So our host basically holds a sign with our patient's name on it, just exit of the airport. So they pick the patient up, and they have the transport and everything. And also, the great thing is that our patients know how their journey would look like day by day before they arrive to Turkey. So they know their schedule. And so this is a full service from the pickup and till their departure flight. We are with them, and we are facilitating all of their needs. For example, it may sound funny, but most of our patients would like to get a new haircut after rhinoplasty, or they would need their nails refill after the surgery because they need to take their nails off, or lashes fill. So we are there for all of their needs. It's just, we just want to make this as a safe and fun journey for them and take this stress component out of the equation.
Brilliant. Okay. And what about when they get back home? What would happen, like, if they had any issues or anything like that, or any problems?
Yeah. So yes, they have to stay here for around 9 or 10 days, like 1 week 1 week after the procedure, and assuming that they arrive 1 day before the procedure, so it has up to 8 or 9 days as a total of stay. So after they departed, before they depart, basically they have their surgeon consultation and free to fly papers signed and sealed for them, and they have their post-op documentation where they can see, like, is this incision becoming infected? They have their pictures. Is this like something I need to be concerned of, or I need to notify my point of contact? So they have this, for example, tummy tuck procedure. In the papers, they can see that this one is okay. This incision is getting a bit tricky, so keep an eye on it. And this is just like the urgent case, so you have to go to ER or our point of contact, basically. So on in 2 stages, we can assist them from via video calls or with doctor consultations from Turkey. For example, infections may occur, especially the patient is feeling really well after the procedure and they suddenly decide to be as active as before the surgery, and they have their stitch off or something like that. So with that, for example, our doctors here prescribe the patient with the medications. So if they can buy it in the UK, that's fine. But if they cannot buy it, or they don't want to bother going their general practitioner, we just DHL them with their medications within 2 days. But when they are in stage 2, for example, we lost the communication, or they just thought it would get better, but it went worse. So we have our partner clinics in UK. So we just refer to them and their numbers, and we inform them about the patient's case beforehand so that they know what happened, because it's a lot of hassle explaining. So just even saying that I went to Turkey and this happened. So the patient is not feeling well, and we don't want them to be overwhelmed by, again, explaining this to their doctors. So we just inform the doctor, our clinic, partner clinic, and they know what to do. They know the process. So usually these cases are treated within 5 days of antibiotics, or just renewing the stitch, or just cleaning the infection site. So there is nothing major complications like hematoma or bleeding after 10 days after the surgery. But this is how we manage if they have any complications once they are back from Turkey.
And I suppose if they did have something major wrong with them, I suppose it would just be the same as if you did have surgery in your own country. You just have to go to ER, wouldn't you, I suppose?
Yes, absolutely.
Yeah, that's brilliant. Okay, so sorry, I forgot to ask you as well, how much would somebody expect to pay, like, for, say, a tummy tuck compared to the UK going to Turkey? What would the price savings be?
So the savings would differ, but it will be around £3,500.
Okay.
So what we are charging is around £4,000 for tummy tuck, including accommodation, around the clock nurse, and airport transfers, pickups, spare pair of compression garments, all medications, a lymphatic drainage massage performed at aftercare hotel. So this is just a very free package, basically, as I mentioned before. So everything you would need is included in the package, and it's a final cost. For example, we don't do surgery, like excessive surgery, but let's say, given your condition, you have to stay another night in the IC room, or you have to stay in the IC room for one night, so we pay for it. Or you may need to extend your stay, we pay for it. Basically, it's the final cost you pay, and everything in the unlikely case they occur is covered by Klinik Europe.
It's very good. You nearly would pay that for a holiday anyway, wouldn't you?
Yes.
That's great. I suppose maybe in Turkey the cost of living is just a lot less than what it would be in the UK, and that's probably part of why the price difference is like that. Okay,
Absolutely. Absolutely.
Brilliant. So it's brilliant speaking to you today. I'm going to put your contact details in the comments below with the video so that anyone can get in contact with you if they're thinking of having cosmetic surgery in Turkey or, you know, anywhere else. Yeah.
Thank you so much, Rana.